I think everybody has heard of this medical phenomenon known as the placebo effect, okay? You're put in a trial, okay? Or maybe, okay, you're told to just take this pill. It'll make you just, perform better, okay? It'll fix whatever ails you. But then at the end of the day, when somebody tells you that was just a salt tablet and why is my headache gone? Oh, okay, cool. That's your body taking over and knowing how to fix it and doing it for you, not being held back by any mental blocks that you may have enacted for yourself, and instead just accomplishing what it can. So to break this down and to be a little bit more scientific, because I think that's what we're going to be trying to do this week, we're looking at things through a little bit more of a clinical scope, because I just want to shift it up, and it doesn't really much matter because I'm the only one who watch these anyway. So if you manage to watch these sometime in the future, you can take a look and follow along on my intellectual expansion, shall we? Did you ever feel your own shoulders relax when you saw a friend receive a shoulder massage? No, because I don't watch my friends I'm not a massage cuck. That's weird. For those of you who said yes, congratulations. Your brain is using the power to create a placebo effect. For those who said no, you're not alone, but thankfully the brain is still trainable. Ah, yes, you can grow up and be a trainable. Awesome. Since the 1800s, the word placebo has been used to refer to a fake treatment, meaning that one doesn't contain an active physical substance. You may have heard of placebos referred to as sugar pills. Yeah, take a salt tablet. Today, placebos play a crucial role in medical studies in which some participants are given a treatment containing an active ingredient of a medicine, and the others are given a placebo. These types of studies help tell researchers which medicines are effective and how effective they are. Surprisingly, however, in some medicine, placebos themselves provide patients with clinical improvement. There's normally a certain amount of people who manifest this phenomenon, but the effects are normally short-lived, okay, and very specific to certain individuals with a very powerful mindset. So let's take a look here a little deeper. Today, scientists define these so-called placebo effects as positive outcomes that can't be scientifically explained. It's magic by the physical effects of the treatment. Research suggests that the placebo effect is caused by positive expectations, the provider-patient relationship, and rituals around receiving medical care. Depression, pain, fatigue, allergies, irritable bowel syndrome, Parkinson's disease, and even osteoarthritis of the knee are just a few of the conditions that respond positively to placebos. Interesting. I think with the exception of IBS, we've talked about all of those recently. Despite their effectiveness, there is a stigma and debate about using placebos in U.S. medicine. Why? It's like the gold standard of clinical research trial. Double-blind placebo tests, everybody's heard the term and everybody knows that that is legitimately the gold standard. And in routine medical practice, they're rarely used on purpose, but based on a new understanding of how non-pharmacological aspects of care work and safety and patient preferences, some experts have begun recommending increased use of placebos in medicine. U.S. FDA, the organization which regulates new medicines, and they do a great job of that, don't look any deeper in any of their documents, requires that all new medicines be tested in randomized controlled trials that show that they are better than placebo treatments. This is important part of ensuring that public has access to high quality medications. But studies have shown that the placebo effect is so strong and many drugs don't provide more relief than placebo treatments. Yeah, that's why you need to know, okay? And that's why you have a big test group out there, because you need to know if either your medication, your supplement is just, ethereal hokum, or if it's actually worthwhile. That's why I need to run these tests. In those instances, drug developers and researchers sometimes see placebo effects as a nuance that masks the treatment benefits of the manufactured drugs. That sets up an incentive for drug manufacturers to try to do away with placebos so that drugs pass the FDA tests. Placebos are such a problem, for the enterprise of drug development, so that a company has developed a coaching script to discourage patients who received placebos from reporting benefits. Treating depression with placebos, eh? Oh, maybe people just like a little bit of a sugar rush. Prior to the COVID pandemic, about 1 in 12 U.S. adults had a diagnosis of depression. During the pandemic, those numbers rose to 1 in 3 adults. I'm never forgiving any elected officials who voted overwhelmingly for these stupid mandates. Sharp rise helps explain why $26.25 billion worth of antidepressant medications were used across the globe in 2020. Yup. It was all for your safety, but we're going to make you sicker, fatter, and sadder. Congratulations. According to psychologist and placebo expert Irving Kirsch, who has studied placebo effects for decades, a large part of what makes antidepressants helpful is alleviating depressions is a placebo effect. In other words, the belief is that the medication will be beneficial. Depression isn't the only condition for which medical treatments are actually functioning at a level of placebo. Many well-meaning clinicians offer treatments that appear to work based on the fact that patients get better. But a recent study reported that only 1 in 10 medical treatments reviewed were supported by high-quality evidence, according to the grading system by an international nonprofit organization. A lot of psychologists or psychiatrists, whichever psychologists, right? They just push pills. They just push pills because it's effective. It just gets them off the couch. It just keeps them on the couch as well. It gets them out for the day, but it keeps them coming back week over week. Just dangling this carrot right out in front of them. Oh, eventually you'll get better. Just try this pill. Oh, that one didn't work for you. Okay, try this pill. Fucking disgusting practice. That's why many times we're looking at depression, anxiety, common mental health problems on the channel and finding natural cures, because I want people to get off these worthless antidepressants, anti-anxiety medications, because they're just that. There's no magic pill that's going to make you feel better. There's no magic pill that's going to make you less anxious. The problem's between your ears, and you have to work on it up there. This means that many patients improve, even though their treatment may not have been proven better than placebos. I can't drive it home any harder than that. So how does a placebo work? The power of placebo comes down to the power of the mind and the person's skill at harnessing it. If a patient gets a tension headache and their trusted doctor gives them medicine that they feel confident will treat it, the relief is that they expect is likely to decrease their stress. And since stress is a trigger for tension headaches, the magic of the placebo response isn't so mysterious anymore. Now, let's say the doctor gives a patient an expensive brand name pill to take multiple times per day. Studies have shown that it is even more likely to make them feel better because all of those elements subtly convey the message that must be good treatments. Yes, if people have a specific proclivity to giving up to or rather have a superiority fallacy, proclivity to just bow down to authority, you can pretty much just take a knife and carve in a little T into a sugar pill and just say, oh, it's a Tylenol. And then, if they're feeling a little bit too much pain, just carve in a little 3 or a 4 beside it, and T4, don't worry about it. Part of the beauty of placebos is that they activate existing symptoms of healing within the mind and body. Elements of the body once thought to be outside the individual's control are now to be modifiable. Interesting. Legendary example is of Tibetan monks who meditate to generate enough body heat to dry wet sheets in 40-degree Fahrenheit temperatures. Interesting. Just about freezing, and they can dry wet sheets. Alright, something's going on in Tibet. A field called mind-body medicine developed to work for the work of cardiologist Herbert Benson, who observed those monks and the other experts mastering control over automatic processes of the body. It is well understood in the medical field that many diseases are made worse by the automatic changes that occur in the body under stress. If a placebo interaction reduces stress, it can reduce certain symptoms in a scientifically explainable way. All right. Most people are familiar with the Pavlovian conditioning. Yes, a bell rung giving a dog meat makes them salivate. Eventually, the sound of the bell causes them to salivate, even though they didn't receive any meat. Same thing can go on after a Harvard medical school successfully used the same conditioning principle to help patients use less opioid medication for pain following spine surgery. That's awesome. And emerging research suggests that even when people know they are receiving a placebo, the inactive treatment still has the effect on the brain and reported levels of improvement. Placebos are non-toxic and universally applicable. Yeah, because the principles described earlier are just applicable across the board. using placebos to help people in an ethical way. Yeah, because you don't want to be duping people. Like, okay, if somebody has a severe cancer, like they have blood cancer or something like that, well, I guess all cancers are kind of severe. And it's like, well, we're just going to give you placebo chemotherapy. That's probably a little bit unethical. I'm just going to throw that one out there. It might be a violation of your Hippocratic oath. It's not like any doctors across the world haven't been doing that over the past couple of years, but whatever. Placebo effect is recognized as being powerful enough that the American Medical Association considers it ethical to use placebos to enhance healing on their own or with standard medical treatments if the patient agrees to it. Clinically, doctors use the principles of placebo in a more subtle way than it's used in research studies. A 2013 study in the United Kingdom has found that 97% of physicians acknowledged in a survey having used some form of placebo during their career. This might be simple as expressing a strong belief in the likelihood that a patient will feel better from whatever treatment a doctor prescribes, even if the treatment itself isn't chemically powerful. There is now even an International Society of Interdisciplinary Placebo Studies. They have written a consensus statement about the use of placebos in medicine and recommendations for how to talk to patients about it. In the past, patients who improved from the placebo effect might have felt embarrassed as if their ailment wasn't real. No. It's just your body is an amazing resource that once it is untapped and once it is tapped rather, and your potential is unlocked, it's amazing what your body can do. And there's that old myth that people only use 20% of the brain, where it's like, it's probably a mistranslation and mischaracterization of the quote, but there's a lot that goes on up there that not a lot of people know about, even in a clinical setting. With the medical field growing acceptance and promotion of placebo effects, we can envision a time when patients and clinicians take pride in their skills at harnessing the placebo response. Yep. I'm very interested in finding out, the source of this, figuring out how to unlock the placebo effect on demand, because that would kneecap big pharma, and that in and of itself, undermining that murder factory is a win in and of itself. But if people can start, looking after themselves and start healing themselves of just common day-to-day problems. I know this is awfully ironic, considering I sound like this right now. I just give it enough time and I'll eventually, heal myself. Otherwise, maybe I'll just end up succumbing to the other side of that. But that's highly, highly, highly unlikely. If we can start advancing this way to a more natural approach, the one that doesn't have devastating side effects, I think that's just a big win for humanity, really. With that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.